babies, children and young people. So it should be a really, really helpful and supportive thing for us to start to think differently about the system. So I've just a few bits of housekeeping just to go through before we start. We are going to record the webinar. It'll be available on our website. And so what we do ask is that everybody apart from the speakers have their cameras off, so that we are able to then have it on the on our website. And likewise, we don't have any oral questions while we're doing this. We tend to ask you all to put your questions into the chat, because basically that way we can then we can come read them out and we can then present them for you. It just means that way we're able to just have the speakers and myself speaking, and then we'll be able to have it available in the future. The only other thing to say is that if anybody would like to have the slides in Welsh, then they're available on request. But at the moment, the slides are in English only at present. So yes, so basically cameras and mics off for everyone apart from the speakers. It's nice if we can see them. So what are we going to? So the first thing I was going to ask you all to do is you will all have been very used to this by now, as you've been to many of our webinars probably. But basically, if you could just click on that QRS code on the front page there. Sam and the team will also put it into the chat for you. And that just means that will be for our feedback, but also we've got a little quiz coming up now. So it's just nice for everyone to be able to, just join on with that. So what I'll do is, I'm not sure if it's on the next slide as well. So I might just leave this slide on just for a moment while we do this. Oh, it's on there. The super organized team that we have. So what we wanted you to think about is, approximately when did the increase in children and young people's mental health difficulties begin? I can see lots and lots of people who are responding now. I'm going to leave this one just for a few minutes longer. Am I a bit quiet, Sam? Is it me that's quiet? Is Sam saying, can everyone hear okay?
I can hear you fine.
Okay, no, that's fine. My computer seems to have a life of its own, and sometimes people can hear me and sometimes they can't. So let us know if anybody else is struggling. Oh, Esther can hear me fine as well. Okay, great. Okay then, so I think that most people will probably manage to download the Mentimeter by now. So what we've got here at the moment is 52% of you have said 2020, which would be a logical thing to think because of the pandemic and all of the different impact that it had on our children and young people. But actually the answer is, I shall let Sam reveal the answer, is actually 2010. And that's quite interesting, isn't it, to think that actually our baby children and young people started to have issues way before the pandemic. And I think, as we all will be able to say, that's only compounded things. So if we move on to the next slide, please, Sam. What proportion of secondary school pupils in Wales said they felt worried or very worried about climate change? Just wait for the... Yeah, well, everybody is clearly very up on the feelings of baby children and people in Wales, because you're absolutely right. So yes, 70% of secondary school pupils are very worried about climate change. And I have to say, as someone who comes from Monmouth originally, I think that there'll be lots of young people there who will be absolutely in agreement with that. So if we're moving on to the next slide, please. What proportion of 14-year-old girls in Wales have been cyberbullied? Okay. So yeah, I think that started to slow down now. And yeah, absolutely. I think we've had 2 easy questions this time because you all got them all completely right. But yeah, absolutely, 36%. Absolutely, that's which is really scary, isn't it? When you think about the impact on their mental health that cyberbullying and that fear, and sometimes they just don't feel that they're able to share or tell trusted adults and things. So absolutely, really concerning there. And then we've just got one more question, which came from our third speaker today. Thinking back to your childhood, how did playing make you feel? Free, happy, excited? Interestingly, when the team asked me, I said embarrassed because I always felt like actually I had to be quite grown up, and so I always felt that playing, and that's not ideal, is it? I think that actually play is such a formative part of a child's life. So absolutely connected, not a care in the world, relaxed, adventure, carefree. Ah, so lots of people don't seem to be able to hear the presentation. Um, I'm not sure. Can most people hear? Yeah, there are lots of thumbs up here. Okay. All righty. No, we've got most people who can. That's okay. Right. So it might be something on your computer, Errol. So um, and then now I've just managed to, having just done that, I've just managed to come back to all the people and sorry, we seem to be having all sorts of IT issues today. So yeah, Sam, unfortunately, I can't see the slides now. So anyway, don't worry. So that was really, really, really interesting. Really interesting just to get people to really think about things a little bit differently. So we're going to move on now to our speakers. And I wanted to introduce the first two who are going to be doing a double act. So we've got Emily van der Venter, who is a consultant in public health and interim director of health improvement with Public Health Wales. She's worked in public health for over 15 years, and while her experience is broad, she specialises in population approaches to promoting mental health, wellbeing, and reducing inequalities. Building on the expertise that she gained from her BSc in neuroscience and MSc in public health. She works closely with Welsh Government, NHS, and non-health partners to support the implementation of the mental health and wellbeing strategy for Wales. Emily has done so many things in her career that I could be talking to you for nearly the whole time. So I'm going to leave it at that. But actually, really, really delighted. Oh, no, sorry, that she leads the HAPPERS programme, which aims to inspire and enable people to take action to improve mental well-being, taking a positive, psychologically informed approach to motivate individual and community level action. So it'd be really fascinating to hear what she's got to say today. And then we've got Dr. Philip Hill, who's a senior public health practitioner for Public Health Wales, working with the mental wellbeing team. He's currently working with stakeholders and young people on a needs assessment, focusing on babies, children and young people's mental health and wellbeing in Wales. And then prior to commencing in public health, he completed a PhD in the area of motor competence, biological maturation and cognition. So absolutely fascinating. And so I'm going to now hand over to both of you. Really looking forward to hearing what you've got to say. And then, like I say, for everyone, if you've got questions, please pop them in the chat. But as well as that, we're going to be, the team will be things that Philip and Emily refer to. The team are going to be populating that in the chat as well. And as usual, Sam has produced a Padlet for you all, which will have all of the resources, which you can be emailed after the event, so that you've got all the resources in one place. Anyway, I will move on.
Thank you, Claire. Yeah, so I'm going to make a start. Like Claire said, I'll touch on some of the data that we've included within the needs assessment. Mindful that this is very much a flyby, but trying to pick out some of those key points. And then Emily will speak around what we can do both within our roles, but as part of those wider communities that we're all living in. Next slide, please, Sam. Yeah, so just to make an initial start, and it's very much important to emphasize just how crucial, when we're talking about mental health in children and young people, this is starting very much from infancy, so has a key influence not just on mental health in terms of adolescents and young people, but wider life and health outcomes across the life course, kind of highlighted by that second bullet point there. So now consistent evidence saying that half of mental health conditions in adulthood are established or will show symptoms by age 14, and then by age 24 that moves up to 75%. So yeah, really emphasizing how important these ages are in terms of getting those building blocks right. Next slide, please. So this figure just shows global increases in prevalence. So as touched on in the Mentimeter, kind of consistent, so not unique to Wales by any stretch. So kind of around that 2008, 2010, we've seen increases in mental health prevalence in most countries, more so in girls than in boys. But as this figure shows, this is relating to adolescents specifically, but across childhood and adolescence, you'll see similar increases, like I said, from that kind of 2008, 2010 time frame. Next slide, please. So we're focusing on infants and parents. So there's not like-for-like population level data available in Wales, but from the research that we've done, we know that there is strong alignment in a lot of the prevalence data with England. So the most recent for England was in 2017, and that suggested that 5.5% of 2 to 4 year olds will have symptoms of a mental health condition. More recently, there's been a meta-analysis that suggests if we widen that to 1 to 7 year olds, it increases up to 20%, with 6% of these having more than one condition. And within Wales, there's been research by the Parent Infant Foundation. So what this tells us is that 15 to 20% of babies, could benefit from a parent-infant intervention. And that could be for a number of reasons. That could be poor attachment, it could be parental mental health, it could be related to instability in terms of housing. And then that last point there, which is a really important one. So 40% of pregnant women in Wales aged 20 to 29 years report a mental health condition at their first antenatal assessment. And as I'll touch upon in a later slide, that's a really important one, because we know in terms of causal evidence, parental mental health is a key risk factor for a child or adolescent developing mental health symptoms. Next slide, please. So we use this slide because I think sometimes it's important to take a step back and just look in terms of what this means in terms of numbers. So those requiring support across the system. So where like-for-like data isn't available, like I said on the earlier slide, we've used data from England, prevalence data from England, but altogether, so from ages 1 to 24, we're looking at a figure of an estimated 190,000 children and young adults requiring some level of support for symptoms that would suggest a mental health condition. So I think when you put it in terms of figures like that, it's quite alarming. Next slide, please. And so this is specific to emotional difficulty. So when we talk about overall mental health prevalence increases, a lot of this increase is underpinned by emotional difficulties. And again, a lot of that is underpinned by increases in girls. So from 2017 to 2023, we've seen an increase within the region of kind of 7 to 10%. The data on this figure is specific to 2023, and what it shows us is the increase across secondary school years. So from year 7 up to year 10 and 11, we can see that sharp increase, kind of over 10%. So by year 10, over 50% of girls will be experiencing high or very high emotional difficulties. And so, like I said, emotional difficulties, we've seen very big increases, especially in girls. For boys, a lot more stable. And this graph is kind of mirrored across every year from 2017. So you'll see a very similar pattern in terms of boys and girls, with the boys being a lot more stable. And just to point out, so those figures on the right, so in addition to emotional difficulties, we've also seen increases in self-harm, so up 12% since 2014, and also eating disorders. So whilst that data is from England, we've also seen increases in Wales in terms of body image, and those increases have been for boys and girls. Next slide, please. We also know, though, that there's an unmet need. So what this graph on the page shows us, this is for anxiety, and we can see similar increases to what we've seen in prevalence up until the pandemic. We see the expected drop then for the pandemic, and since the pandemic there's been a slow recovery, and it hasn't quite got to the levels pre-pandemic, which tells us that many children and young people are going undiagnosed and unsupported, and obviously this is crucial because we know that the evidence tells us that very rarely will young people and the symptoms resolve themselves, and the longer that they're waiting without them being diagnosed or supported, the more severe the symptoms are likely to come. Research, so this is health board research in Wales, and just trying to unpick some of the issues that might underpin this. So half of young people didn't know where to access mental health support, less than a third felt confident in accessing support, and then only half felt that their views were considered when accessing or receiving support. Next slide, please. As you can appreciate, there's a whole array of risk and protective factors, so I won't spend too much time on these. Just to say, it's important that we differentiate between those that are causal and those where there's an association. So for Wales, we have causal evidence that these three here, so poverty, academic pressure, and then, as I touched on earlier, parental mental health, there's evidence to suggest that these cause mental health difficulties in children and young people. You also have then evidence, social media, for instance, sleep, bullying, where there's strong association data, but to this point, it doesn't explain the increases that we've seen across that kind of time period that we've touched on. Next slide, please. So this just touches on sleep because this is an area I think where there'll be focus moving forward. So like I said, association data at the moment, and what this slide shows, this is from England. So they split it up between those children that have symptoms suggesting a probable disorder and those that are unlikely to have a disorder. And we can see on the right hand side there in the orange, those with a probable disorder having difficulty sleeping 3 or more nights is above 70%, and quite a difference between those unlikely to have a disorder. So evidence suggesting that sleep is likely to be playing a big role in heightening mental health difficulties. Next slide, please. Again, just touch on this. So we've done some work with the Wolfson Centre at Cardiff University. So these are the youth advisory group, and they have lived experience. We spent a day with them, and then they've been working in the workshops with us. And since what came out of those talks in terms of the treatment pathway is that they really felt that there wasn't an understanding of co-occurring conditions, and that this is something that they found really challenging when trying to work their way through the treatment system. In terms of what they felt the key risk factors were, so unregulated digital technology came out really strongly, employment and housing insecurity, especially those transitioning from university into employment roles, climate change, which we touched on before the start of the presentation, and then the importance of third spaces, so that community aspect, which in terms of inequalities really came out because for some they felt that there was opportunity to really explore these, and for others they just didn't feel like there was any opportunity to become involved in community activities and networks. Next slide, please. So apologies, I'm sure many on the call will be quite familiar with the mental health strategy by now, but just to quickly touch on, so 4 vision statements which we hope will really encourage and support the mental health of children moving forward. So that first one, very much aligning to the principles and the wider determinants of health, getting those building blocks right, and from which to really progress with the next three. Vision statement 2, so everyone having the knowledge, and so Emily will touch on this, but we're doing some work with the HAPAS national conversation, but very much about, improving that confidence, the opportunities, not just at an individual level, but at that wider community level. And then the last two is about creating that wider system. So it's moving away from the traditional model, but a system which talks to each other, where the child, the young person, can get the right support first time and without delay, very much trauma informed and consistent right across the pathway. Next slide, please. And this slide just touches on some of the work. So ourselves, Public Health Wales, but working alongside a whole range of partners across the system and colleagues, and some of the work that's already ongoing. So the whole school approach to emotional mental well-being, so schools kind of being that really important pillar now as part of this new strategy. The early years framework for action, and so like I said, really making sure that mental health in infancy becomes a priority, that those building blocks are really established at those very young ages, and then working with partner organisations to increase mental well-being promoting activities and community-based support. So as I said, that leans into the HAPAS work, but really understanding that community has such an important part to play in getting the foundations right. Next slide, please.
Thanks, Phil. So hi all, I'm Emily. I'll pick up from where Phil's left off now, and just to say a big thank you to Phil. He's done a great job summarising a huge amount of work that's gone into the last year to understand actually what are the patterns in children and young people's mental health and the key drivers of some of those increases. So we want to talk, of course, a little bit about what we can all do to support babies, children and young people. So there's some key principles here. This slide really talks both up to things we can do and think about for babies, children and young people, but also for ourselves and those that we work with. As staff, I would encourage you all to prioritise action to look after your own mental well-being. We know that if you're in a better place, you will be providing more compassionate, better quality care and support for those babies, children, young people, families that you're in contact with. So it's one of the fundamental elements really of good mental health and well-being is having this sense of connection and belonging. So that's feeling connected to yourself, knowing what your values are, what really matters to you, connection of self to others. Social contact is really important, and having trusted relationships, people that we can turn to when we need them. But even those small interactions that we have with people in our communities or in our workplaces can make a difference to how we think and feel during a day. A sense of control and purpose, so that's thinking about both your work, but also when you're supporting families and children and young people, enabling them to have a say in the care that they receive. And then other items around really looking out for signs of stress in yourself. We're often less good at identifying when we're struggling. Often other people around us may notice some of those early signs before us. So trying to notice what are those signs of stress within yourself, but also looking out for others and signposting to support, checking in on how people are doing. Ask how you are. We always say ask twice because we're very British often, and we will give that standard response of all is well, thank you. But so have a follow up. Are you sure you're really all right? And if you're thinking about young people that are coming into your services, recognizing that it's a distressing time for them. You will be working in environments that are just day-to-day routine environments for you, but actually for the babies, children, young people and families that are coming into your services, it could be quite an anxiety-provoking experience, even just coming into a clinical setting. So taking a bit of time to understand where they're coming from and recognize, validate their experiences and their emotions too. Peer support is really important. So again, thinking about yourselves as staff, who do you have within your workplace that you can turn to, who understands the things that you're going to and has some of those shared experiences, but also how can you encourage children and young people to connect with others that might be going through similar things so that they can have that shared support and understanding. And of course, signposting to support. So if you're in a physical health service and you're picking up that actually young people might be feeling distressed, then of course signposting to GP, to NHS 111 press 2 for the family, for the young person themselves can be really helpful. But we talk about support in its broadest sense as well. So Phil has touched on the importance of feeling connected within our community. So that support, it might be teachers within a education setting, it might be trusted adults within the community that people can turn to. So if we can go to the next slide. I've just got a quick diagram here that captures some of those really key individual and community level components that contribute to our mental health and our well-being. So just to pick up on a few of these, I've said around thoughts and feelings, understanding that children and young people coming into your service are likely to be feeling anxious, concerned, worried, recognise and validate those feelings. That's really important, to not just dismiss and kind of say everything will be okay, but just really meet them where they are. Understanding the world around us, it's how we put meaning around the things that have happened to us. So I think there's overlap there with some of our sense of self. And in terms of young people needing support, it's really important, particularly mental health and well-being, to recognise that actually it's about what's happened to them, not about what's wrong with them. So really recognising and trying to encourage people to have that self-compassion and not blame themselves for things that are happening to them. I've touched a little bit on in terms of that importance of control. So when you're in a health setting, I know I feel it when I go into the GP, there's always that power imbalance. So trying to recognise that and really consciously, proactively address that and encourage people to enable people to have a sense of control and a say in the care that they receive. Connections with communities, when we talk, so our Happers campaign is very much built on all of these things, but some of the things that the evidence really shows helps to support mental well-being are connecting with nature, particularly when you see that statistic at the beginning around how concerned young people are about climate change. Engaging with nature and taking action to support nature can help them feel a sense of control over what actually can otherwise feel a huge problem that they have no influence over. But we know that connecting with nature not only supports mental well-being, and the evidence base is growing on that, but it does improve pro-environmental behaviours as well. So it has benefits for the environment and for nature. But also connecting with hobbies, engaging with creativity and engaging with physical activity are important for well-being too. And of course our wider health outcomes. And when you think about that slide earlier on around young people struggling to sleep, being more active in the day, getting our physical activity levels up can help us sleep better at night too. So please do encourage people to think about that. And then where we live, work, learn and play. So our environments around us, the communities that we live in, absolutely have a huge role to play in terms of our mental health and well-being. So Phil mentioned the work we're doing to promote the whole school approach to emotional and mental well-being. If you're a parent, I would encourage you to speak to your school, ask them what they're doing to create well-being promoting environments, because all schools are expected to be taking action within this. Have a look at the early years framework as well, get familiar with that and have a think about actually what more could you be doing within your service to address the components there that are really important to give people a best start in life. And play, we will hand over to Marianne now in a moment. So play is really important. You can, all those feelings that people shared earlier about feeling a sense of joy and safety, you literally cannot feel those feelings alongside feeling stressed, anxious and worried. They're different neurological pathways. So bringing in elements of play, opportunities to spark joy for children, young people and families is really key too. So we'll stop there. But thank you for listening.
Thank you both. That was absolutely fantastic. Just a little bit, just to whet your appetite. And there's so much more that we can explore. And obviously, if people want to hear more in the future, we can obviously invite them back if they're happy to come back. But yeah, I think one of the things that I'm always saying to our team is that what we need to do to get children's health and children's well-being on, or baby children, young people's health and well-being on the agenda, is actually to really identify the things that make children different. And I think that play is one of the things, they have a right to be able to play. So I think it's really, really important and appropriate that we've actually got Marianne Manello now here, who's actually ringing in, I can't remember which country, but she's in a different country at the moment because she's at a conference. So we're really grateful to her that she's come today. She's the Assistant Director for Policy Support and Advocacy at Play Wales, which is the national charity for children's play in Wales. She's got over 40 years experience in many aspects of play and development. Marianne has worked with Welsh Government to support the development of a toolkit to support local authorities in undertaking the play sufficiency assessments. And she's also the organisational lead for play sufficiency, children's rights, health and wellbeing, early years and neighbourhood play provision. I don't know when you have time to sleep, to be honest. So she leads on the active play indicator as a member of the Active Healthy Kids Wales report card expert group, and is also the lead author for the Play and Leisure thematic briefings as a member of the Wales UNCRC. And fascinatingly, during lockdown, she achieved a long-held ambition to master the hula hoop. Now, we're not going to ask her to do that for us today, but I'm really interested about this now. So, yeah, I'm going to hand over then to Marianne. But that's a fascinating fact to include. Thank you.
Diolch yn fawr, Claire. Thanks very much. And Prynhawn da, everyone, thanks for the opportunity to come and speak. And so today, as Claire's already mentioned, I'm the Assistant Director at Play Wales. I'm going to talk briefly about some of the policy around children's play, look at the role of play for health and well-being and happiness, explore synergies between policy drivers, and then just some information about some resources that we have that you might find useful in your day-to-day work. If I can have the next slide, please, Sam. Thank you. So Play Wales is the national charity for children's play. If you haven't heard of us, we champion every child's right and need to play by raising awareness, providing examples of good practice and promoting that, and advice and guidance across all areas. And we work towards Wales where play is valued for being so crucial to health and healthy and happy childhood. If I can have the next slide, please, Sam. So just we talked briefly about how playing makes us feel through the Mentimeter. And so I kind of just think it's really important to hold on to those play memories. Some of us can go right back to baby and toddlerhood, and some of us kind of are stuck at 14. But we promote the right to play for babies, children, and teenagers. Older children play too. And I think that's really important. And some of those feelings that came up in the Mentimeter are what children are telling us now, how play makes them feel. Brave, adventurous, happy. Free was one of the first words that come up in the Mentimeter. And friends are really, really important, feeling connected to where they are. If I can have the next slide, please, and then the next one, please, Sam, as well. So the policy background in terms of the right to play, which Claire has already mentioned, and it seems fitting to talk about it today. It's Universal World Children's Day today, so the anniversary of the ratification of the United Nations Convention on the Rights of the Child, the most signed up to human rights treaty in the world, with the majority of nations signing up to this human rights treaty. The right to play is enshrined in Article 31 of the United Nations Convention on the Rights of the Child. Now, from time to time, if the committee that looks after the United Nations Convention on the Rights of the Child feels that one of the rights is misunderstood or not well understood enough, it issues further guidance around that article. And in February 2013, it issued what this guidance is known as General Comments, and General Comment 17 talks specifically around Article 31 rights. So the rights to play, recreation, rest, and culture, things that children do in their leisure time, in their free time, when grown-ups aren't telling them what to do. If I can have the next slide, please. So the General Comment gives us a really lovely definition of play. It defines all the other elements of Article 31 as well, but I want to talk specifically about play. And this definition will probably resonate with your play memories as well. It describes and defines play as a behavior which has key characteristics of fun, uncertainty, challenge, flexibility, and non-productivity. So intrinsically motivated. When children are playing, they are playing for the immediate joy that it brings to them. The general comment talks about all of the deferred outcomes and the developmental outcomes that playing brings, such as physical development and emotional development. We'll talk a little bit more about that in a moment. But what's really important, I think, from a rights perspective here, is that the general comment places play as a fundamental dimension of the pleasure of childhood, a fundamental here and now for children. So going back to that bit about non-productivity, when children are spinning round and round and round and round, and you ask them what they're doing, they're not saying they're recalibrating their muscles and their neurons so that they can sit in a classroom or hold a pencil. They're doing it because it's fun, or they're pretending they're in a washing machine, or they're pretending they're on a roller coaster. So I think it's really, really important to hold on to that really vital dimension of childhood. If I can have the next slide, please. And the general comment also gives us some useful links between Article 31 rights and other rights within the UNCRC. And what it says about play and health is that children and babies, children and teenagers should be able to live in a way that helps them reach their full physical, mental, moral, and social potential. And that state parties, so those are governments, are encouraged to take into account the implications for children's rights under Article 31 when they're developing policies relating to things such as social protection, especially for those children without opportunities for play and recreation in their own homes. If I can have the next slide, please. The general comment also strongly encouraged state parties, governments to consider introducing legislation around Article 31 rights, and that the legislation should address principles of sufficiency. Can I have the next slide, please? So a bit of context. In 2010, Wales became the first government globally to legislate for children's play through its Children and Families Wales measure. So this, some of you will remember that this was at the time, the Welsh Government at the time's anti-child poverty strategy, and it places play, a whole chapter on play and participation within that piece of legislation. If I can have the next slide, please. Sam. So within, whenever there's a piece of legislation, there's statutory guidance which accompanies that, and Welsh Government has produced a piece of statutory guidance called Wales, a Play-Friendly Country, where it points out the conditions which need to be present for children to make the most of their opportunities to play. So the conditions are psychological, spatial, and temporal. And translated in layperson's terms, that is that children have enough time when they're able to play, that the space is good enough, so how we manage space, both public space, but also places within settings, and permission. And these are the factors to what extent adults support children's play. This can be at the home level in terms of parents and to what extent they allow their children to play, both in the home and just beyond it, but also in settings. And Emily mentioned, the whole school approach to play, and the whole school approach to well-being first. And I think it's really important. There's a whole chapter within that whole school approach to well-being, which talks about the importance of play. So it talks about having enough time to play and being allowed to play, and that the space to play is right. So right across all of our policies, we can make these connections. If I can have the next slide, please. And I think specifically there are lots of synergies between play policy and education policy, and we've physical activity policy. And a key one is the extent to which playing meets the goals of the Wellbeing and Future Generations Act. And we have been able to map play across those goals, and playing in particular in terms of being a better place for children to grow up now, but in the future. If I can have the next slide, a little bit of the research, and then the next one, please. So in a couple of years ago, Play Wales published an updated literature review in terms of the current research around children's play. It's called Playing and Being Well, and it draws together, it has a focus specifically on Wales social policy, but it points out all of the important benefits that playing brings for babies, children, and teenagers, supporting socialization. So when children are playing, they're interacting with one another, developing friends, dealing with context, so making friends, breaking friends, becoming friends again, learning that tolerance for one another, understanding what different children's capabilities. It's crucial for good health and well-being. Being active, Emily's related, kind of referred to this as well. Being active through play develops children physically and emotionally, contributing to that immediate health and happiness. Play supports children to feel part of their neighborhoods and wider communities. And this is something that came up earlier as well. Feeling connected, learning around the world around them, making connections, you know, in terms of neighborhoods, learning about the characters and characteristics in terms of play. It's well established that play supports learning and development, both in terms of structurally, in terms of brain development, but also those immediate skills of creativity, problem solving, and critical thinking. And all of that combines nicely to build resilience. All of the literature points to the fact that when children have opportunities to play, it is boosting their emotion regulation, their confidence, their creativity, that enabling them to deal with the day-to-day stresses and challenges through life. And so therefore it plays out for children experiencing situations of uncertainty or crisis. It is as important as it's ever been. The research places play as a core capability and talks then about the dynamic relations between children and their immediate lives, their physical lives, social, political, so on. And the findings point towards a relational capability approach in shaping play-friendly places. The relational capability approach allows for a strengths-based approach for children playing and being well. So basically the research is telling us when children have enough time, space, and permission to play, it equips them with their skills to look after their immediate well-being. It is one of the rights that children have, that they can look after themselves. They can provide for themselves if the conditions are right. They can't vaccinate themselves. They can't teach themselves algebra. They can make that better and easier. But play is just one of those rights, and it's one of the rights that children understand really well. So I think it's really important for us to hold on to that, regardless of what our role is in children's lives. And so that relational capability approach, the importance of playing and being well, places a collective responsibility on us as adults to ensure that the necessary resources and opportunities are available and accessible for every child. If I can have the next slide, please. Just a little bit of kind of a previous rapid review in 2020. When we first went into lockdown conditions, a rapid review of previous quarantine conditions indicated that to support children living in and emerging from those sort of lockdown experiences, that play was one of the most important areas to focus on to promote children's health and well-being. So in terms of, kind of the next slide, please, in terms of what the real experts say, the most recent report that we have published in terms of children's views around their play was just published last month. It is an analysis of play satisfaction surveys that local authorities undertake as part of their statutory play sufficiency assessments. And we have data from just under 8,000 children from 16 of the 22 local authorities in Wales. And what children are telling us is that when they have the opportunities to, playing outside is their favourite place to play. And some important messages in terms of today's discussion around mental health and well-being. Children are telling us that when they have opportunities to play, they feel amazing. They have nothing to worry about. They like it because they've got friends on streets that knock for them and don't leave them out, and they go to fields or woods or the street. And that there are lots of places to jump and move, and that helps with my ADHD. So those are really strong messages around how children can support their immediate well-being. Give them opportunities to run and jump or do the things that they like that meet their preferences and needs, and that helps them immediately to manage their own health and well-being. Now, I feel a bit like an imposter in a space full of people within the NHS and medics and public health professionals. I don't remember a lot from my high school biology and zoology, but what I do remember is that if there wasn't a need for something within a species, it died out. And this is in 2025, we have children, beyond any of the myths that we have around children's and their opportunities to play, they are telling us it is important to them. And today, on World Children's Day, it is, I compel you to listen to those voices. Can I have a next slide, please, Sam? So in terms of what we can do to support the mental health and well-being of babies, toddlers, children and teenagers is to try to bring some play-informed practice into our day-to-day lives. This requires practitioners and caregivers who understand the need for play, communities and settings where playing is tolerated and celebrated, and policy programs which provide for those opportunities to play. So we can allow children to self-organize their play, think about how play-friendly their environments are, look at ways to build in outdoor play however we're working with children, developing setting-based play policies and promoting the importance of play to caregivers, to parents. Can I have the next slide, please, Sam? So we have a range of resources available to support children's right to play in settings. I haven't talked about a specific piece of work that we're doing today looking at play in healthcare environments because I wanted to kind of concentrate on the theme of the day. But we have all of these resources are available bilingually on the Play Wales Quail Cymru websites. I noticed earlier in the chat somebody mentioned something about the Neath Nest framework. So that third document in the focus on play makes the links between those policy links between play sufficiency, play work, and the Nest Neath framework. So that may be something you might want to look at. In terms of whole school approaches, we talk about the importance of opening school grounds for play. And in terms of supporting parents and caregivers, we have a whole website called Playful Childhoods aimed at parents and communities. If I can have the next slide, please, Sam. And that's all of those resources are available, as I said, bilingually on the Play Wales Quail Cymru websites. And I'm not sure if you're going to be able to, I have a very small clip of a film. Brilliant, Diane, Sam, appreciate that. So this is a clip of a film which we produced a few years ago. It was actually filmed during COVID time, so it was really, it was a slow burner because we had shots cancelled because people were isolating or our camera people were off unwell. And the working title at the time was "Why is Play So Important?" And it's filmed throughout Wales, various locations throughout Wales, and as well as filming children at play, naturally occurring play in some settings and in some neighbourhoods, it also brings in children's voices into the mix. And we're going to hear some of those today. And when we started to watch these clips of children talking about the importance of play, we changed the title from "Why is Play So Important?" to "This is Why Play is So Important," because the children demonstrate wonderfully how important it is to them. The full film is only about 15 minutes long, and it's available on the homepage of the Play Wales Cwrdd Cymru websites. But this is a short clip just to wet your whistle. I think Sam's going to play it for us now. Thank you.
It's just like mental health, because like if you just didn't see anyone for like a month and just sat in a dark room or something like that, and you didn't speak to anyone, you'd just be really like let down, and you just wouldn't be happy. And then if you see people like every day, play with them, then you'll be fine. Like, yeah, you feel like you have lots of people you can trust and stuff.
Skateboarding and cycling makes me feel just free, independent. Like when I'm out here, I'm on my own or I'm with my friends, and it just gives me a chance to get away from school or whatever's bumming me out that day.
I've made so many new friends, and like I've told them personal stuff, and they've literally like took me for who I am, and like they really care about me. And like every week I can't wait to come up here, and it's just the best feeling you can have.
Diolch yn fawr, thank you.
Brilliant. Oh, thank you, all three of you. Absolutely fascinating, different perspectives, but absolutely amazing. We've got a couple of questions and also some comments. Liz Gregory was saying that thank you for always referring to babies as well. And I think it's really important that we all start to use that babies, children, young people terminology, because I think babies get overlooked, but also it's a hard time for families. So it's, as Liz was saying, it's really important to recognise that how much support families need when they have a baby in the family. Sarah Jenkins just had a question. I know you've answered, Phil, in the actual chat, but I wondered if you could just share it with everybody. She was just asking about your health needs assessment for babies, children, and young people, and when it's going to be published.
Yeah, I think we're aiming for mid to late January, so we're just doing amendments on climate anxiety and a few other little bits, but yeah, I think we'll probably be in touch. I'm not sure in terms of how that'll be communicated, but happy to share with everyone when it's published.
Yeah, we'll make sure some comms go out. Also to flag, we've got a joint statement on children and young people's mental health being published on the 25th next week. So we're hoping to get some media attention around that, and that's kind of summarising the patterns that we found and some of those really key findings based on a whole load of engagement with leading clinicians, academics, and engagement with young people themselves as well. So the more detailed report to follow, but if you're needing something as a lever for investment opportunities or for some of the work that you're doing, then please look out for that joint statement coming next week.
Fantastic. And obviously if we can help in disseminating the information, we can send it out to the attendees today into our distribution list as well. There was another question in the chat which was just about how are you defining mental health? So I'm going to let Phil or Emily, whichever of them are going to, and was it about symptoms or you know, what's your definition that you're using?
Yeah, thank you. So a lot of the data there was taken from either population surveys in England or within Wales, the School Health Research Network. So they are self-reported by children themselves in terms of some of the feelings, symptoms, difficulties that they're having. So slightly different there, but they are well-validated scales that there are kind of cut-off scores for to say this is probably a mental health difficulty. So some of the figures you see were combined for kind of any mental health difficulty, and some of them more specifically then around emotional difficulties. So that's picking up on symptoms of anxiety, depression, for example, and there are different domains in that. So the results are all based on strengths and difficulties questionnaires. The survey in England also uses responses from teachers and parents as well. So it's a bit more validated in terms of having those kind of more robust in terms of being able to say it's probably a mental health system. Whereas in Wales, it is just based on the young person's report. But we've been triangulating the data, hence we're confident in the figures that we're producing for Wales in terms of those that are likely to have a mental health difficulty. In Wales, the scores so the categories, categories used in England, they talk about probable or possible mental health difficulty. In Wales, they've got categories of very high difficulties or high difficulties. So they broadly relate to each other. So the numbers that Phil was presenting earlier by the age group, and we were talking around over 190,000 young people. Those are young people that are likely to have a diagnosable mental health condition. And then some of the other statistics around emotional difficulties, the probable mental health condition tends to relate to the very high scores. So on top of those estimated numbers, we've also then got young people that would be classified as high emotional difficulties, so not yet diagnosable mental health difficulties, but really likely to be able to benefit from some early intervention and support.
Fantastic. Thank you so much for that. And then we have 2 questions for Marianne. Then I'm afraid we're going to have to wrap up and do our very quick evaluation at the end, but because I think we could have literally had a whole day session on this today. I had a very quick question for Marianne, which is a bit cheeky, but I think it will actually help all of the people who work in the NHS, hopefully. So we're working with Welsh Government at the moment, who are developing their quality statement for child health in Wales. And we've been mentioning about ensuring that play is in there. Because actually children have a right to play, including when they're waiting in doctor's surgeries, waiting for appointments, when they're inpatients and all those sorts of things. But are there any references or any pieces of information which you could share with us about what should be provided, and also evidence that we can demonstrate that this is an important thing for them? And then I've got another question for you afterwards. Thank you.
Yep. So we have two resources which I can send to Sam so that he can add them to the Padlet, if that's okay. So we've been concentrating specifically on play in healthcare settings. Recognize, and it grew from an audit that I was involved in, a service evaluation that I was involved in for one of the university health boards that looked across play in the on pediatric wards. But thinking about healthcare settings generally, it is something that is overlooked, and COVID didn't help that because toys got put away, they got thrown away, playrooms got closed, same things with waiting rooms, all of that sort of stuff that used to keep children occupied, but also, interested, went by the wayside. So we have 2 documents in particular. One is an information sheet, which is probably at practitioner level around how to consider play in healthcare. And it talks about the role of qualified health play specialists, but then also gives some helpful hints about what you can think about in healthcare settings. And then we have a focus on play policy briefing around play in healthcare. And that's aimed more at kind of strategic stakeholders to say, we've got to start to take this seriously. The health inequalities regarding access to play, for children in healthcare settings is obvious now. Children are telling us they value the opportunities to play. In those settings, parents are telling us it helps with both rehabilitation, but also in feeling settled in those spaces. So yeah, we've got two pieces of work, and it's a key bit of my work plan at the moment. So we've been working very closely with Starlight Children's Foundation. Some of you may have heard of. They're the organization that advocates for play in healthcare settings. So watch this space, but anything that you can do to amplify that voice. People expect me, kind of a gray-haired hippie who works for a play organization, to talk about play across all settings. So we need medics and the NHS generally to say this is important and what can we do about it. Thank you.
Yeah, no, 100%. And I think you'll find many of the health professionals, doctors, nurses, allied health professionals here completely with you. It's not just a distraction for the children, it's a necessity. And then we had one other I'm going to have to ask you to answer it very quickly, or if you've got anything you can share with us. But is there any evidence from Charlotte Davis in Haldar, any evidence on the type of play that's most beneficial to support young people's mental health? I'm just thinking of autistic young people whose play might look different, but might still give that sense of joy. So is there anything about what specifically might help individuals' mental health?
Yeah, I mean, I think anything that is self-directed supports that immediate well-being. Now, that's not to say that children don't benefit from supervised, structured opportunities to play, and they benefit from having trusted adults to help them, but it needs to be measured up. And very often, specifically with disabled or neurodiverse children with additional learning needs, the sorts of play that may be offered to them tends to be more through a rehabilitative lens. So I think, yeah, looking at that relational capability approach, so we immediately think that, you know, autistic children will have a relationship with their world which may not be typical, and so we just need to bring that joy into it. The other thing is, yeah, it's a long answer, unfortunately, but I will bring some things together through that playing and being well literature review and share it with Sam probably sometime next week, but he can upload it onto the Padlet. That literature review is published. It's available on our website. It's big. It's a ream of paper printed, but it is available, and we have summaries as well. So I would look towards that, but I'll put something together for Sam. Thanks, Claire.
Thank you so much. Like I say, we could have done all day for this. So I wanted to say thank you. So can everybody, well, two things. While I'm saying thank you, would people mind just opening their Mentimeter again? And we've just got just 3 very quick questions. But thank you so much to our 3 incredible speakers. I think we could have had a whole session just for each of you. So it's been absolutely, and it's just, the whole point of these sessions is to try and get everybody to think slightly differently, and I definitely think we're all going to be doing that from now on. So we're just going to move on to the next, just the question now. So what do you all need to enable you to be able to support the mental health of babies, children, young people that you care for? So you can put it in the Teams chat, or you can, yeah, it's probably best to put it in the Teams chat. So that's brilliant. And then what we'll also do, we'll move on to the next one. On a scale of 1 to 10, this is using the Mentimeter. Did the webinar meet your needs today? And while you're all doing that, I just wanted to say that our next webinar is on January the 20th. We've got Amy McNaughton speaking about early years, and we've got a second speaker, but we're just confirming them as well. So that will be a really, really important session for people. We'll be sending out information about that next week, so that people have got time to join, to register. And also then the next one will be a little bit different. We're doing immunisations with Lisa Lovegould, who's the National Director for Vaccinations, and it's a joint one with Maternity Neonatal Network and ourselves. So it'll be covering vaccinations right through pregnancy up to 18. So that will be really invaluable as well. And that will be in February or March. We're not sure. We haven't got the date quite yet. So great. So thank you so much for that. And what will you take away from this webinar today? Inspirational. I completely concur. Absolutely amazing, all 3 of you. Play, joy, inspiration. Children need to play, joy. And I think that the link between mental health and play is so important, isn't it? Which is the reason why we sort of married these two sets of speakers up today, because we just thought it's really important when we're thinking about one, we can't rule out the other. So positivity, ideas, importance, bring up play more often. Yeah, I don't know how often parents think about it. It's sort of, so I think it's a good thing to be able to share with parents, isn't it? Fantastic. I'm sorry I'm hurrying everybody. I'm just conscious that I try and keep to time. And then what child's health subjects would you like to be covered in the future webinars? We have got a resource. We've got all of the ones that you've ever requested. We are working our way through them. So this was one of the ones. Immunisation is definitely one. So we've got a list. Yeah, infant mental health. We're definitely, that's going to be covered in the next one actually. That's the second speaker with Amy. We're just confirming vaping, AI. Yeah, absolutely. Eating disorders, adolescent mental health, absolutely. Screen time. Oh, screen time. So many people talking about screen time at the moment. So 100%. Eating disorders. So Yeah, and we've also had lots of things about trauma informed. You know, there's all sorts of different ones we've had. So we're keeping a tally of all the things that you request, but also you can reach out to any of us in the team and please ask, you know, let us know what you'd like us to cover. If it's to do with health or children, and preferably both, then, you know, we're really happy to do it. So yeah, absolutely. Well, I'm so sorry I've kept you 4 minutes over. I really apologise. Thank you so much to our fantastic speakers. Thank you all again for coming, because we always have such brilliant attendance in this. I really appreciate everybody's involvement, and see you on January the 20th, and happy World Children's Day, which, yeah, so to you all.